For this subtopic number 2, we will focusing on two important things. First would be the importance of the approach that is using in public health in comparison with any other narrow approach available out there. And the second one that is important would be what are the steps should be taken if we are planning to do any public health nutrition program, because these other steps should be taken into consideration if you are planning to do or implement anything. We call it as a public health nutrition cycles. For this particular subtopic, these are the two key things that's going to be highlighted. The approach used in public health nutrition is focusing on the promotion of good health to nutrition and the primary prevention of nutrition-related illness in the population. For example, looking at whether higher intake of saturated fat will lead to atherosclerosis or etc. The approach to public health can be divided into broad and narrow approaches. For example, for the nature of public health activities, if it is based on broad approach that will link public health science with policy, but if by using the narrow approach, it will be used cause containment or disease prevention. The advantages of using broad approach in public health is due to its long terms and potential global impact in comparison to narrow approach, which is only looking at short-term effect. For example, in Malaysia, for the year 2015, April normally is the National Nutrition Month for Malaysia, and the focus is actually prevention of diabetes. This particular theme is focusing for the national guideline or the national activities that should be taken so that the public are aware what will be the focus for that year. As an overall, normally all those national public health nutrition program is focusing on the mass impact, which is targeting at all population of all ages. In nutritional epidemiology, it is normally will provide scientific basis for the development of the evidence upon which public health action can be implemented. Normally, with epidemiological studies, factors affecting processes in the whole population can be determined. For example, what are the key public health problems, communicable and non-communicable diseases are related to malnutrition? Have to understand the statement malnutrition is actually focusing on both ways. If it's malnutrition, both under and overnutrition are lumped together as malnutrition. As you know, in Malaysia, we are currently experiencing both double burden of diseases. I'm taking example for the children in Malaysia, despite that we have about 5% that is actually from the National Health Mobility Survey that are still underweight or undernourished, we still have an escalating problems of childhood overweight and obesity. It is expected approximately about 70% of all death in 2030 is due to non-communicable diseases problems. For example, in this slide, tobacco and diet are accounted together for up to 60% of cancer in high-income countries. There are several stages of demographic, epidemiological, and nutrition transition in public health nutrition. Focusing on nutrition transition, the prevalence of undernutrition has reduced due to receding famine that is a shift of diet-related non-communicable diseases. Policies are also developed to improve the health of society based on scientific evidence. In this slide, the development of policies which is focusing in public health nutrition are influenced by several stakeholders that includes political, economic, retailers, and others. In the public health nutrition cycle, 7 steps are crucial to be included. First, the assessment. What we required for doing this assessment is to understand the situation of analysis. For example, in a situation where a residential area or a place where notice there's a lot of overweight or obesity, it is crucial to understand what are the factors that can lead to overweight and obesity in that particular group. Second, define the problem operationally. Defining the problem operationally, you must understand what would be the issues you're trying to target or trying to highlight, and in what way, how it actually going to impact health if this particular problem not going to be addressed. The third one would be identify the work team. It is very crucial to understand that no one can work alone. Hence, especially in public health, you need to work with several stakeholders. Fourth, analyzing the problem. Once you have discussed and you know what would be the problem, of course there are several things that can lead to the problem. You should prioritize which one can be actually done first. 5, develop solutions. As I mentioned earlier on, to prioritize what are the things to be conducted first, despite of we have several issues that can influence one particular problem. 6, after all these identifications, you need to understand what would be the best program to be implemented. So thus, the 6th step is called the implementing program. Once implementation have done, for example, if you know the problem just now about overweight obesity, you do a program looking at several things such as dietary intake, physical activity, built environment, and so on. Then you need to understand if the program works or not. And thus, the step number 7, which is evaluating the outcome or quality, it is crucial. Because with this, then we will know whether that's going to be helpful or not. As I highlighted earlier, just to repeat, the step number 1 is to identify the key nutrition-related problems, because this falls under the assessment as a first step in public health nutrition cycle. Second one would be identify the problem and then develop the suitable program that should be implemented. The third, the most crucial part, is evaluating the program, either it is effective or not. There are several key messages in public health nutrition which include the promotion of good health through primary prevention of nutrition-related illness in the population.